Welcome back to the Voices in Health and Wellness podcast, where we explore real conversations with practitioners and innovators redefining what modern care looks like. Today I'm joined by Dr Negin Rajaipour, board-certified family medicine physician, founder of Vita Rican Medical, and creator of a really powerful integrative framework known as the E3 method: Elevate, Embody, Evolve. Negin's work sits at the intersection of functional medicine, nervous system regulation, and trauma-informed care, bringing together both adverse childhood experiences and what she calls adverse adulthood events to really understand the full picture of a patient's health. So with that, Negin, I'd love to welcome you to the show and thank you so much for joining me today.
Thank you so much, Andrew. I appreciate the invite. I am so grateful to be here and share my work on your podcast with your audience.
Thank you. Well, maybe we can start at the beginning. Can you give us a little kind of snapshot of your journey? What drew you into medicine and how you've kind of ended up doing the things that you currently do in practice?
Absolutely. Sorry, but something keeps popping up on my screen. So the short version is that I'm a physician who became a patient. So I created this framework because it came out of my own experience. And this is something that I wish existed when I was going through the collapse that I was experiencing. So everything, Vita Rican Medical, the E3 method, the resurrection algorithm, these are not business ideas. These are born from personal experience and asking the question, how to rebuild after collapse. Even though on the surface, I was a very strong woman who's made it, who's successful, as a practicing physician, but internally, I felt the collapse and the falling apart. So that's basically the genesis of my work.
Thank you. No, it always helps to have some context, and I often find that there's a personal element to someone's journey or their inspiration for what they do. So thank you for sharing that. And I know you have a background in emergency medicine. How did that shape the way that you now approach functional medicine?
Yeah, I mean, I realized that we do miracles in emergency setting with Western medicine, right? We can stabilize a patient in shock. We can bring someone's heart back into rhythm. But when it comes to chronic care, unfortunately, we fail miserably. And I think that's probably part of the reason why you are practicing functional medicine. And a lot of us are moving into those more integrative spaces to really understand and help patients on a different level when it comes to chronic care.
So tell us a little bit about your current practice and the current things that you're doing to help and serve clients. Where are things in 2026 for you?
Yeah, absolutely. So right now we're in pre-launch, actually soft launch phase of Vita Rican Medical. So I've built the E3 model that runs, basically is the driver engine of my work, Elevate, Embody, Evolve. So we look at a patient as a whole. We look at their story, what is at the root of their ailments, which is usually rooted in nervous system dysregulation and their patterns. We address those in addition to the embody phase, which is basically optimizing the physiology. That's where the integrative and functional medicine comes into play. And the evolve is the identity rebuilding. So we have to build on a stable foundation. Otherwise, no matter what we treat the body with, it is going to fail because the nervous system will basically relapse into what's familiar, what feels safe, even though safe could be killing the person.
Maybe could you perhaps give us an example, talk us through maybe a typical patient journey in terms of them showing up with you, your assessment, and how things go from there?
We look at childhood trauma. Everyone is familiar with the ACEs, adverse childhood event, and its connection to all sorts of chronic issues, including cancer, obesity, autoimmune disease. We look at adverse adulthood experience, which is really poorly served in medicine. We think that because you're a grown adult, you should be over it. You should process it. You should, move through things quickly. But we discount the fact that even adulthood adverse experiences, they rewire the nervous system the same way childhood adverse experiences rewire the nervous system. So that's kind of like asking the right questions. Instead of what's wrong with you, we ask the question, what happened to you? So that basically where we start the work. And then we look at the downstream effects of trauma on the biology. So we know the HPA axis disruption. We know the cortisol elevation that wreaks havoc on the HPA axis, on the sex hormones, on thyroid function. So we go after treating all of those things, including insulin resistance, you know that from high cortisol state. Insulin resistant develops, resistant weight that we can't shake off no matter how much dieting, exercising we do. So that's basically how that's structured, and the sequence really matters. It's very important. Even though everything is kind of addressed simultaneously and in parallel, but we have to make sure the nervous systems is restored to a baseline of parasympathetic state, which is rest and heal state. And then everything that we do with integrative and functional to the body, then it will hold. And then everything we do to restore the identity, that will hold as well. So no matter, a lot of the personal development is rooted in behavior change, whereas the pattern is stuck in the nervous system. So no matter how much you force the behavior, the mindset, the person is going to relapse back because the nervous system was never addressed. So we address the nervous system.
Thank you. So you're a traditionally trained physician by background. When did you start realizing that just addressing the physical side of some of the things you were seeing wasn't really enough and you had to delve deeper into some of the things that you've been talking about just now?
Yeah, absolutely. I learned most of it because I became my own first patient. I carried a load of childhood trauma from my background. I'm an Iranian immigrant to the US. I grew up in basically at my birth, revolution happened, the war happened, 8 years of war, so my childhood. Parental discourse and divorce, everything just took a toll, but I wasn't aware of it. I thought I was okay. I was making it through. I was successful. I'm now in the US. I went and did the military service. I went to med school. I raised 2 daughters. And, but underneath it all, there was always this undercurrent of suffering and pain that eventually took a toll on my body after an acute situation that came up due to my divorce as a single mom raising 2 daughters. So that really just opened my eyes to the importance of nervous system regulation and the role it plays in our physical health, because I had to rebuild from collapse, both on not just emotional and mentally, but also physically, because stress takes a toll on our body. It's silent, but it's there. And then over time, it just builds up to a point where your body can't sustain it anymore.
And how does your approach differ from what most functional medicine practitioners are currently doing? Because I'm guessing they're a little bit more enlightened than the average traditionally trained physician, but clearly you're doing something over and above what conventional functional medicine would do as well. What's the kind of difference there?
The difference there is the elevate part of the E3 protocol and the evolve part. So the embody encompasses functional medicine, integrative medicine. We treat the physical person as a whole being, but also we address the nervous system and the identity portion of it. So what comes next after we do all this work? We repattern the nervous system. We get the person into a safe space in their life. We address all the downstream effects of health issues that we can address through functional and integrative medicine. Now, what comes next? Who are you now? Are you your trauma? No, you're not your trauma. You're not your story. So we have to rebuild from that space. So that's the missing part of integrative and functional medicine that I think my protocol addresses.
And do you find patients are really aware of just how much trauma or nervous system dysregulation is impacting their physical health when you see them?
You know, honestly, I wasn't even aware until I did the ACE score, until I did the AAE score, and I really looked at the impact, the burden I'm carrying. You know, I had been to therapy for years and years and years, but, you know, talk therapy is very effective at intellectualizing and understanding things, but you don't get deep into truly understanding your story. It takes years and years to do that. But with these tools, we can shortcut the time and really get to the bottom of what is going on at the nervous system level, what the pattern is that's running behind everything, and addressing that simultaneously addressing the physical health challenges.
You just mentioned these scores, so it sounds like a really helpful and objective way of trying to get some clarity over an assessment you have with a patient. Can you just tell us a little bit about more what the scores measure and how they help you with your assessments?
Yeah, absolutely. So the adverse childhood event score, that looks at basically all the childhood trauma. So if your parents divorced, if your parent was emotionally absent, if you were bullied, physically abused or sexually abused, like all of those things are being asked. And the adverse adulthood experience, which I have created, that looks at what happens after childhood, because a lot of people grew up in beautiful homes. They grew up with secure parents. They had, you know, very comfortable and secure upbringing. And nothing major happened during childhood, but then they come into adulthood and they're betrayed by a friend. Their job of 10 years suddenly fires them, you know, after giving their life to that profession for a long period of time, and they're suddenly discarded. A bad divorce happens, a betrayal by a romantic partner happens, loss of a child. You know, these things are all traumatic events. And so the AAE score accounts for all of this, and we look at how it impacted the person. How is it impacting the sleep structure? How is it impacting how the person shows up in leadership, how the person shows up in their life, in their relationship with themselves? So that's where the work is, really getting to the root.
Thank you. I don't know if you're happy to share. Would you mind sharing perhaps somebody you're working with at the moment, obviously anonymously, just to give us an example of how this has completely changed the outcome for them? I know you shared your personal experience, and I want to depersonalize this from you. Perhaps somebody you're working with at the moment, just so we can get a deeper understanding of this process.
Right now, I'm in pre-launch phase. I can speak from my own experience and tell you what I've done for myself. So basically, I've been in therapy off and on for over 20 years. I had a lot of childhood trauma, military trauma. I wasn't deployed, but I lost friends during deployment. I had the heavy survival guilt, which at the time I didn't understand. I was in my 20s. I was in an abusive relationship where I was physically assaulted. So I was carrying a lot of trauma that I had just kind of pushed aside, right? And kept functioning, kept showing up, getting through undergrad, having 2 children, complex pregnancies, going to med school and my marriage falling apart. And suddenly I'm a single mom and going into residency. And that in itself is very traumatizing because you're suddenly responsible for people's lives, especially as an intern. And these were emotions that I had pushed down and suppressed just for the sake of showing up and being who the world expected me to be. And being, in the military or in medicine, you're rewarded for being able to suppress your emotions. You worked in the emergency room, or you're currently practicing ER doctor. You go in, one patient, they have a bad outcome or they don't make it. You literally you have feelings, right? It hurts. And you have to push that aside and go talk to a patient who's pregnant and expecting, or go deliver good news about, what your workup showed up. So you have to be able to transcend the sadness of a tragedy within minutes, right? And go and talk to another person who's in front of you and needs your attention equally. So these things just took a toll on me. And one day I couldn't function. My nervous system completely shut down. Before that, I was physically struggling. I had fatigue that none of my labs could account for. I had pains, body aches and things that none of my labs could account for. And trying to make sense of it all is what basically brought me here to this work. I went through my own journeys, deep inner work, not just therapy, because therapy alone didn't help uncover everything I needed to uncover, because I was even closed off to therapy. I wasn't showing up as an open person, as an honest person to really look at myself. I was showing up closed off. So what really in my journey has been extremely helpful is psychedelic assisted therapy. That helped me open up immensely and be able to let my ego down, let the guards down, and really look at myself from a perspective of compassion and understanding, not to find fault with others or judge others, but to understand truly what has led me to this point in my life where I'm, successful on the outside, everything looks good. And internally, I feel dead. My body's falling apart. I am emotionally drained and exhausted. So that is also part of the Evolve. And I'm looking at phase 2 launch for an actual physical clinic where we can actually help patients with that level of intense inner work that is required sometimes, because traumas build layers and you can't just, maybe you scratch the surface with therapy, but you don't know what's there. Sometimes you have even forgotten the things that have happened. Your brain is so good at survival, so good at protecting you, so good at keeping you on task, keeping you showing up, that sometimes it's not even in our conscious mind anymore, and we have to dig in.
Thank you. There's a growing conversation around psychedelics, and you've just mentioned psychedelics in mental health. How do you view their role in trauma healing and functional medicine?
I think they have great potential in trauma healing. I have experienced both ketamine, which is legally used in the United States in ketamine clinics, and I have experience with plant medicines in legal settings, countries that is allowed under supervised guidance. These are not something you just willy-nilly take and in an effort to escape. This is deep work and requires structure, requires guidance, and what comes after is the work that really makes the difference. The psychedelic experience itself shows you where the work is, but what you do after in integration, in therapy, that's where the real change takes root.
Do you think the system is moving in the right direction when it comes to integrating mind-body approaches? Because you're coming to this as a conventionally trained physician. Obviously, you ventured into the functional medicine space, and now you've got your own model. But are we generally moving in the right direction?
I think so, but the movement is very slow. I think we need to speed it up. We need more clinical access to psychedelics, whether it's plant medicines that have been around for thousands of years, and we have data from the shaman and the medicine man and the people who have experienced these things, to our conventional drugs like ketamine, MDMA. All of these things, we need access. We need protocols. We need safety, patient education, and systems where we can actually employ these things in our practices and really make a difference for our patients.
Thank you. And what are you seeing right now in terms of burnout, both not just in patients, but also practitioners?
Yeah, it's all related. I think burnout is rooted in trauma, whether it's moral injury, whether it's, chronic stress from being on call, from the training itself, from abusive environments, whether it's from peers or from patients. I think it's all related to trauma, and it can be addressed not with another pamphlet or self-care guidance, but really talking about what happened to you from a non-judgmental, loving standpoint, not to put the person in a place where they feel judged, they feel questioned, their integrity feels questioned. So that's basically where the work is in regards to burnout and addressing that. And it's rampant for physicians. And I was one of them.
Yeah, for sure, I can ratify that. I'm sort of working in a specialty like you've done before, which is high intensity, high risk of burnout. So I completely get it.
There is no space to process trauma. I remember being in a code for 45 minutes, trying everything to save this person's life. And then I have to go talk to a 3-year-old next door. So there is no time to process. There is no time to really sit with that. And afterwards, there is no time to integrate, really talk about what happened, and not what happened in a medical sense, but what happened to you as a person who you felt hopeless and helpless in saving a life. Now you have to go talk to the families and tell them that their loved one didn't make it. Still brings tears to my eyes because I still hold all of that. This is someone's mother, father, brother, sister. We are not just robots. We are human beings being placed in situations where we have to deal with the ultimate suffering of another human being, but we're expected to perform like robots. And that's not okay. We have to open up our hearts. Medicine has to open its heart to its practitioners and become a more compassionate system from a punitive system. Because right now, burnout, physician burnout or the nurses burnout equals punishment. They have to suppress it and perform. They have to continue performing. They have no choice because they're looked down upon by the system. So that the system needs to claim its humanity and recognize that burnout is not a character flaw, is not a professional flaw. It's just the human function that needs to be addressed with the heart, not with diagnosis codes or computers and, the whole gamut that goes into addressing burnout nowadays.
So switching gears slightly, thinking about your practice as a business, because you are running a business, what's working really well for you right now? What are you most proud of? And I know you're in your sort of pre-launch phase, but just sort of thinking of it from a snapshot, what are you most proud of?
I am the most proud of my protocol. I think all of us as doctors, we have our credentials. But what really sets us apart is the protocols that we come up with for our patients to have the best outcomes for the patients. And if you have something in you that speaks to your soul, bring it to life, own it.
And on the other side of the coin, which are the challenges or bottlenecks which are most impactful in your work at the moment?
So the challenges I've been dealing with right now, AI is evolving really fast. Technology is evolving really fast. Every single delay I have faced so far is because of technology changes. So I'm trying to keep up and manage. I pick a path, I go with one thing, and I'm like, oh no, this is even better. So that's why it's been taking me like a year to build everything out, the infrastructure, the protocols, writing the book, launching it, really fine-tuning everything. And on top of everything, I'm developing courses. So for patients who are still physically fit, they don't necessarily need the medical model, but they can use the trauma healing aspect of my work, which is through the resurrection algorithm and rebuilding identity after trauma and collapse.
So is AI not making your life easier, as one would expect, rather than harder?
It is making it easier once you start learning how to implement it. So right now I'm still in the phase of I learn one thing and then there's something else advances and I need to keep up with that and learn that. So yes, AI has a lot of potential to make our life easier as long as we can keep up with it in a timely fashion.
And you've mentioned that you're working on standardizing the patient journey as part of the process. What's been the biggest challenge in doing that?
I think the biggest challenge for me is really translating clinical and psychological processes into a format that patients can easily understand and can easily integrate into their life and also easily reiterate it or speak about it from their own understanding of the protocols. I think the medical storytelling is the biggest challenge. We have all these cool drama shows and medical terminology that doesn't always translate into patient understanding of exactly what is happening. So that's the meat of it, like trying to come up in and talk about things in a way that is clinically sound, but also patients can understand it. So I've been doing a lot of social media content. I think that's really important, helping people really understand what it is you do and how you can help them. And you have to say it in a way that's relatable to them. Because, we can get carried away with medical jargon and people don't understand a lot of times. They're like, okay, yeah, but okay, cool. But how does that help me as a person? So bringing it really, that's, been very, I guess, my biggest challenge to learn in communication and be able to tell the story in a way that people can relate to, apply to their life, and also seek it out if it's relevant to their experience.
So, as I understand it, you're building a telehealth first model with plans for a physical clinic. How are you thinking about that transition?
So it's not so much of a transition. It's a phased, structured plan. I hope to launch the telehealth and the phase 2 within the next 6 months to 12 months. I would like to open doors as a place for people to actually come in and get more expanded physical treatments, for instance, IV ketamine or some of the regenerative therapies that we can offer. Because telemedicine, even though it's great, we can do a lot. We can reach a broad patient base, but it has its limitations. And I can't get away by just doing telemedicine. I have to have a physical location where patients can actually come in and feel the energy, get the treatments, and we can physically support them in person.
Lovely. And I also appreciate the physical location as well. I've always liked to see patients at least once in person if I can make that work. So I completely get that. There's so much you'd lose over a internet connection or a Zoom connection. There are so many kind of physical cues that you miss with a patient, skin changes, color changes, even watching them walk into the room, all those kind of things are really valuable. So I totally understand that.
And also, this is something our training doesn't teach us. Our presence is missed by the patient. The energy we bring in, you can try to bring that to the telehealth visit, but being in the same room, I feel like it takes it to another level.
If you had a magic wand and you could fix one thing in your business tomorrow or the wider space that you work in, what would that be?
Oh my goodness. I would launch my clinic simultaneously. Yeah. And really just get into the work.
Okay. So thinking about the next 12 months or so, where would you like to be in 12 months' time? I know you've talked about your launches. Is there anything else in your grand plan for the next year?
Yes, I would like to expand licensing beyond the 3 states currently. Hopefully nationwide, having more practitioners who are trained and able to use the protocol and implement it. Having launched the flagship clinic in San Diego and really fine-tuning a scalable model that we can implement in other parts of the country, as opposed to just having one location here. And also developing the courses for practitioners who might be interested in using the model in their practices.
Well, I hope it all goes extremely well. And with that, I'd love to thank you so much for joining me today. It's been a really powerful conversation, especially how you're integrating trauma and physiology in a much deeper way than probably most practices. So thank you, Negin, for joining me. Appreciate it.
Thank you.